All right, welcome to the Friday Fun Fact. It is the 19th of October, and of course, as we all know, October is Breast Cancer Awareness Month, so that's good. Ladies, make sure you check, do the self-check, and make sure you're aware of it. If you can raise some money, things like that, that's good. But today, on today's Fun Facts, some of these facts aren't going to be so fun. I'm going to read you some things from the American Cancer Society off of cancer.org. I'm going to read you some things in here that are good, some that are not so good in my opinion, and I'll just let you make the decisions for yourself, okay? So, first off, an estimated 226,870 new cases of invasive breast cancer are expected in 2012. Of those, we're expected 39,920 deaths from breast cancer alone. So, I'm going to read you some things from the cancer fact sheet. I'm going to put the link on the Facebook page as well, and I highly encourage you to go look at it. It's got all sorts of other cancers, but because it's Breast Cancer Awareness Month, we'll talk specifically about these. Okay, now first of all, I want to say that there has been a decrease in the incidence over the past 20 or whatever years, but from 2004 to 2008, when they've had the most recent statistics, it's been about level as far as rates go. The nice thing is that deaths have gone down significantly over the years. It continues to decline, so that means survival rates are good because people are becoming more and more aware about it. So things like Susan G. Komen, for as much as they are purely pretty much a marketing group, and you need to realize that, when you watch their commercials, listen to see if they ever give rates about anything. They only ever talk about how much money they raise. But they are raising awareness so that women are checking themselves early and often. That's good. Be aware. Pay attention to your body. So I'm going to read you some risk factors. First of all, it says risk factors include weight gain after age 18, being overweight or obese, use of hormone therapy, physical activity, and alcohol consumption. None of those things are all that difficult to avoid. Just work out, maintain your weight, stay away from hormone therapy, be active, and use alcohol in moderation. There we go. Now, I want to read you this too. This is from the risk factors section. High dose radiation to the chest for cancer treatment also increases risk. I'm going to read that again to you. High dose radiation to the chest for cancer treatment also increases risk. Treatment can lead to the thing they're trying to treat. Here's a pain pill. It may cause you more pain. Think about it. Risk is also increased by a family history of one or more first-degree relatives with breast cancer, though most women with breast cancer do not have a family history of the disease. I'm going to say that again. Risk is also increased by a family history of one or more first-degree relatives with breast cancer, though most women with breast cancer do not have a family history of the disease. I want you to go to the website and read that statement. It makes no sense to me. Maybe it will to you. Another risk factor. In BRCA1 and BRCA2 mutation characters, meaning women who have genes that somehow they found carry breast cancer, studies suggest that prophylactic removal of the ovaries and or breasts decreases the risk of breast cancer considerably, although not all women who choose this surgery would have developed breast cancer. Removal of the breasts decreases risk of breast cancer. Duh. I'm sorry to laugh at that, but that's pretty obvious to me. But prevention, if you don't have breast cancer and you're preventing it by just removing it, there's something wrong there. You have to realize that. And then it also says not all women who choose this surgery would have developed breast cancer. Then there's a problem. I might break my arm someday, so I'm just going to wear a cast forever. Okay. Modifiable factors, this is good, listen, are associated with a lower risk of breast cancer, including breastfeeding, moderate or vigorous physical activity, and maintaining a healthy body weight. Now listen to this. This again is part of risk factors. 2 medications, tamoxifen and relaxifene, have been approved to reduce breast cancer risk in women at high risk. So they have medications to reduce the risk. Raloxifene appears to have a lower risk of certain side effects, such as uterine cancer and blood clots. How nice. All right. Here's another one. I like this. This is good. You know, this does have some good information. I'm picking on them, but I want you to realize this stuff because some of it in here is ridiculous to me. I'm going to read you this. The primary goal for future research is the ability to accurately group patients into risk categories that will allow the most successful outcomes with the minimal necessary treatment. Minimal necessary treatment. Minimal necessary treatment. In other words, prevent it from ever happening. They already told you risk factors. There's easy things that you can do. Take care of yourself. Exercise. Don't drink too much. Don't smoke. Make sure you're working out hard. Make sure you're eating good things for your body that reduce the risk of cancer. If you don't know what those things are, Google search it or ask a professional. Come into my office and I can talk about it with you. So, again, I'm going to put the link on there. I want you guys to read some of this stuff. 226,870 cases of new cancer. I guarantee all of us know someone who has cancer. If you do, give them a big hug and tell them that you love them if they're still alive. Because 39,920 deaths in 2012. Okay? There's things you can do. Read up. Be researched. Know that there are alternative options out there. And, you know, take care of yourselves, ladies. Make sure you check it and be good to yourselves, all right? So, a lot of facts, not all of them fun, but have a great weekend. And if you have any issues with this, feel free to call me. I'd love to talk about it. All right. Bye.